and what really the issues are associated with that. PrEP and a lot of misinformation there. So how do we get ahead of that rather than behind it and allowing that vacuum? That's something I'll be interested in hearing from the panel about today. As well as, I know that, and you'll learn that all of us up here are very involved in HIV-specific media, okay? How do we translate that to you? How do we translate that to people who are working in maybe a different audience? So that we can offer you suggestions on things that are sexy, relevant, compelling to your readership, so that HIV stories don't stay in, an HIV ghetto sort of thing. How do we broaden it and make your job easier so that we can fill that vacuum? So to discuss all of this, we have three really terrific people. I'm going to start on the far end. This is Jeff Berry. Jeff is here from Chicago. You can look at their full bios in the program. I'm not going to go into that. I'll just give you.
No, we're not on there because we're all. Well, Jeff is.
Oh, really? You're on there.
Oh,
yeah, online.
I wasn't on there, but you're on there.
Quit squabbling, please. So on the far end, we have Jeff Berry, who is from Chicago, and Jeff is with Test Positive Aware Network here in Chicago. Who've been doing tremendous work for a really long time. They also publish a magazine on lifestyle and treatment for people living with HIV. Jeff is also a long-term survivor, and so his perspective is going to be terrific, just kind of from a cross-generational, how we may have approached it 20 years ago versus today. Next, we have Johnathon Briggs. Johnathon, what I'm most impressed about your resume that I read about is the fact that you have 2 degrees, one in journalism and one in public health, which I think just makes you ideal to talk about how you take those public health issues, in this case HIV, make them relevant to a larger audience in your writing. I think that's terrific. You're also have been, I know you're now with Public Communications Inc., but for many years you were at AIDS Foundation Chicago, who I have big love for, and doing communications for them. So terrific, thank you for coming. And then we have Kellee Terrell here. Kellee Terrell is ferocious. Kellee Terrell, she is, and if you know her, you know what I mean. Kellee Terrell is like this amazing intersection between HIV and feminism and LGBT rights and race, and she did a lot of work at Pause Magazine, then she went on to do a tremendous job at thebody.com, and now she is working in communications for BET. You're a health reporter for BET.com, right?
Yeah.
You're ferocious.
I try.
I don't want to build you up too much.
And I'm a filmmaker.
But do try to deliver. At any rate, so what I think I'm going to start with is a general question to the panel. And let me tell you, once we start with these answers, I want to make sure you're getting out of this what you would hope to get when you come. So if I'm getting off topic for you, or if there's really something you want from these folks that you're not getting, please raise your hand. Please feel free to interrupt what they're saying and raise your hand.
Oh, no.
And ask for a question. Oh, indeed. Oh, yes, indeed. What do you want, water? Already? Okay.
Yeah.
Okay, so, in other words, don't wait until all of these people have unleashed their long explanation of this. And for your panelists, if I ask a question to one person, you have something to add, or maybe even contradict them, how great would that be? Then please speak up. So this is participatory. They'll be talking amongst themselves, but I certainly want to hear either your questions or your input based on your own experience. That's how we're going to handle it. Does that sound cool to everybody? Are we good with that? Okay, great. Let's start with you, Jeff. And just let me ask you this. The topic is taking back HIV reporting. Now, you've been doing HIV reporting every month through Positively Aware. Why is it we're calling it taking back? What is it we're taking back? What is it we're trying to reclaim as journalists in terms of the topic of HIV?
Sure. Well, thanks, Mark, for moderating this panel. I know you came in really late, and I appreciate you stepping up. As Mark mentioned, I am a long-term survivor. I came to TPAN, the organization that publishes Positively Aware, as a client. I tested positive in 1989, and of course, we all know that pre-internet, this is there was no Google search where you could, pull up this information. And so I went to the organization just to get information because I thought I was going to die. I was 30 years old, and I found information and support that I really needed to, carry on and go forward with my life. And so that's kind of what the magazine sprung out of that. And we would go to these meetings Tuesday night. They were packed, and a lot of people were sick. The next week they wouldn't be there. But the information that was shared there was life-saving for a lot of us, and it just gave us hope. And I think that's kind of a constant that's remained the same.
What's the constant?
The information, the support, to be empowering yourself with knowledge about how to live a healthy and productive life with HIV. Because at the time you really didn't know that was possible, but we found a way to do it. So I think empowering yourself to research and find out about clinical trials and find out what drugs might be working, or just to do meditation or yoga, whatever it was. And so I think those are the kinds of things that have stayed the same throughout the epidemic. With the dawn of the internet, so it's very different for an organization like ours that does offer support groups and education, information. Because when a lot of us at your fingertips, so it's kind of like, well, where does that leave us today with publications like POS and Positively Aware, and because people don't really need to go to those support groups as much, because they don't need to. They can find that information and support down in the community. It's much more. I think there's less stigma. There's still stigma associated with HIV, but there's less of it. I think a lot of what is reported in the LGBT media, they get it right. Tracy did a phenomenal job with Windy City Times, and so where I find, and probably a lot of you are, do as well, is in the mainstream media where they just totally get it wrong. There was an instance recently where the Daily Mail, it's based in the UK, and I think it's a web-based, and they ran a headline from a finding from a conference, and it said that there was a revolutionary vaccine that cured 3 babies, and there is no vaccine, as you know, for HIV. So, and they had a picture of a needle and the baby. And, I wrote a letter immediately to the editorial, to the editor, and saying you got this wrong. It's not a vaccine. There is no vaccine. But they finally changed the headline 8 days later, only after the story had been shared 10,000 times. And so, that information, you can never, take that back. The harm has already been done. And so I think it's our job as, people that are in the field to really try to, get out of that vacuum that you talked about and develop those relationships with other reporters and other people working in, more of the mainstream media to try to prevent those things from happening in the first place. Although
so where should people like this? Most of these people do not work with an LGBT-specific outlet. They're writing, they're freelance, or they're writing for some other sort of outlet. How are they supposed to get this information that is more enlightened, more informed than maybe they would have gotten otherwise? Who are they supposed to go to for it?
Is that just for Jeff?
Anyway.
Well, I think we have to take a step back before we can even answer that question, because I think the original question about, what are we taking back, right? So, there was a time where HIV kind of Inc. and gay Inc. used to kind of be the same thing. And that isn't like that anymore. HIV, I'm gonna spill some tea. When I worked at GLAAD a long time ago, I had left PAWS, and I was like, I'm going to have this great job. I'm going to do all this great media strategy, and AIDS is such a huge thing that we're going to do, because I was in charge of black media. And I would keep pushing AIDS stuff. Right. And I would be told over and over that they were very nice about it for the first month. Oh, well, maybe we'll fit that in. Oh, maybe we'll do that. And then finally, they just kept it real. We don't do AIDS here.
And this was to mainstream?
And this was working at GLAAD. So this was in 2009. Okay. We don't do AIDS here.
Okay.
Oh, that's cute, because GLAAD was founded on AIDS. And so when we're talking about what does it mean to take back, if major organizations don't take AIDS seriously or don't want to make it part of like their agenda, because really it's all about how do we get straight people to like us, we're just like them. And that's kind of like what the messaging was back then around marriage and adoption and don't ask, so all these kind of things. And so AIDS doesn't fit into that respectability politics kind of conversation. And so for a long time, AIDS just became positive responsibility, the body's responsibility, whoever wanted to do it. But these AIDS these kind of LGBT organizations did not want to take it on. And if they set the tone of what the agenda is, media follows the tone that they set. And so for me, when we talk about what does it mean to take back HIV as LGBT journalists and allies, it means to own it. And there's a lot of shame around, well, I don't want this HIV, I don't want to talk about this. We're more than just that. And I think it's strange. I also think like the fact that HIV now doesn't just affect LGBT communities, it affects people of color who are heterosexual. And I think the more that the disease has become a shared face, I think sometimes the LGBT community wants to make it, oh, well, that's just their thing. It boggles my mind because this is what has happened. And so I think definitely when we talk about reclaiming HIV as the community to say, this is our problem, this is our issue. And I would like to see more of that happening, even within LGBT kind of journalists. Some people don't even really know that much about AIDS.
Well, much less a mainstream publication.
I think I want to chime in from the mainstream perspective for a little bit, because I feel as though one of the things I think there are two things that have to be taken back. One, we have to take back our power from organizations that are not responsive to our needs, and take back our power from mainstream media, especially given this landscape we're in where anyone can pop up a blog, a Facebook page, you can be your own publisher, your own content and perspective. And I know for me, when I was reporting, I was an urban affairs reporter at the Chicago Tribune, I said, oh, urban affairs, oh, I'll cover HIV/AIDS. How can you not cover HIV as part of urban affairs beat? And I got looks in the newsroom like, okay, but what's new? What's new with AIDS? What's new with HIV? And so what I did, and I think to your I think it was your question about what should these freelance people do, is really I started to reach out and develop sources from credible, cutting-edge people that seem to be on the pulse of what's happening. A lot of those people happen to be at AFC, or they were fellow reporters at Windy City Times. I got some of my best story ideas from reading LGBT media and then trying to get them into the mainstream platform where they get, there's a certain, for better or for worse, there's this sort of credibility or wider platform because it was in the New York Times or it was in the Tribune or it was in...
And they don't always get it right.
And they don't always get it right. So I made it my personal mission. I think this is where it gets down to what is your philosophy of practice? Like, what are you trying to do, right? Like, you're the change agent. Your power is not that's given to you by these external people and things. If this is important to you covering this issue, then you want to have the best sources, the best scientists, advocates, policy people. You want to be that person that gets the story right. I think part of the issue with HIV, outside of the stigma and shame, is that we have to talk about sex. And, I'm not surprised they got the vaccine, they got, the medical intervention mixed up with the biomedical piece of it. You got two things going on. Americans don't understand science, and we don't talk about sex. So how can you even talk about HIV and any cure or treatments and all of that? We don't even understand the basics as a nation, right? Like I think Chris Rock said, America's a nation of C students. And it's sad but true. We need to elevate that conversation.
Well, that has to be nuanced. I feel that's also another thing that's wrong with journalism, is that journalism isn't nuanced. HIV is so complicated. There's so many different things. Like, there are reasons why people don't use condoms, and it's not just about, well, they just don't care. Yeah. I read a lot of articles where in mainstream media where it's just like, oh, these Black and Latino gay boys, they are just out there on Grindr, and I'm just like, it's not.
It's focused on personal responsibility.
It's all about personal responsibility, instead of like these larger kind of things. Exactly. And so when we talk about, the problem is that nuance isn't what we do. I do. We all do. And y'all do. It's those other people. They don't do it. But it's just hard, and HIV is so complicated, and so if you don't, it's so intersectional, and so if you don't understand the kind of intersection between gender and class and all these things, and sexual orientation and gender identity, if you don't understand how all of those things go, your stories are going to suck. And I don't.
And yet that's a lot. That's a lot to digest, and then there's a
not
lot
for
to
me.
understand.
I'm a walking example of
I
intersectionality.
know. But that's why I said you are
Right.
ferocious.
Right. Well,
and there's a lot of people, especially if you have a reporter who's a health reporter and who has everything from cancer to diabetes to everything to cover.
Right.
For them to understand all of the permutations of what HIV means today.
Right.
I think say a couple things. You mentioned, young men of color. And first of all, kudos to Chicago Windy City Times for doing that enormous spread on the 20th year of HIV. And they devoted a lot of space they could have had ads in and a lot of reporting time to a topic that just isn't sexy anymore. And I would venture to say that they not only did they get kudos from other journalists, but they got kudos from their own community for actually revisiting that. And so I think that can absolutely be done in a way that is interesting and compelling, and I think that there are stories now that are interesting.
There's tons of stories that are.
I think of the melding
myself.
of HIV and positive and negative people. The fact that the status is just murky now. You've got negative guys on PrEP. You've got positive guys who are undetectable and not infectious. You've got this murky.
You've got this new tampon that may be able to PrEP for women. I mean,
Yes.
I've never said to myself, man, that HIV is done. I can't write anything else. I can't come up with anything. I mean, there's always something to write
They have
about.
whole scientific journals devoted to this. I mean, there's always something out there. And I think, really one of the other things I think we need to take back is just the framing of the issue itself. I mean, I think, it reminds me of the black press, that really helped spur the Great Migration, where you had the Chicago Fair, you had these black media outlets. They were telling the story, untold story, documenting the history, and basically writing to their audience. Everything is not going to be for everybody. So, to the extent that we know who we're talking to, we should tailor the information to that crowd. And I think with HIV, we have to find the stories that are going to resonate. I know one of my former colleagues at the AFC, she just came out, she's a researcher, she just came out with a study that talks about sort of using Google Trends to predict STD acquisition and all this stuff. And right away it gets your attention, right? Because it's like, okay, well, so many people are on Grindr and this, that, and the other. It's like, you gotta figure out a way to sell it and make it sexy, make people pay attention to it. So I think the more we can kind of figure out, what is going on in their lives that we can kind of, attach an HIV angle to it. I remember years ago when Sex and the City, the movie came out and it was getting all this attention, I decided to write a piece about what if all the women in Sex and the City were black? Well, one of them would have been diagnosed with HIV given the amount of sex that they had. And wrote this whole column about it, and it was one of the most read pieces. It actually appeared in the Tribune of all places. They picked it up. But it's like we got to find ways to latch on to things that people are talking about.
To be innovative.
Think about it in a different way. And I think what I'm seeing now is even some of the terms we use, like unprotected sex used to mean without a condom. That's not even true anymore. If someone's on PrEP, isn't that still protected?
And the CDC just redefined what that phrase
so
means.
It's you got a lot of this sort of I would say technical scientific public health thing going on. Like in public health, we talk about the social determinants of health, which basically just means that income, education, where you live determine your quality of life. We got to translate it into things and stories that people can understand. There was a big CDC study about how poverty is a driver of HIV acquisition. We should be writing stories about poverty within the community. Poverty is another way to talk about HIV in communities of color as well. So I think it's just, I think in this 21st century, we're in the 4th decade of HIV and AIDS. We have to be more sophisticated. We live in a digitally advanced society. People are on, Twitter, and they got all these apps and everything. We just have to step up our game, We do have
Stop waiting for the next person to be the one. I mean, we have this kind of, I call it the bus mentality, where we're all on the bus and we all want to get off at the same stop, but we're all assuming someone else is going to press the button. and then no one presses the button and you go, okay, Mr. Stop. I feel like, and everyone's just sitting around looking at each other like they're stupid. And I kind of feel like we can't be like that as journalists when it comes to HIV reporting. We all have to kind of step up and we all have to claim HIV. And claiming that means maybe dealing with your own fears, your own personal stuff. I mean, I wrote about HIV for a long time, and I don't really tell people this, but like for a long time, even when I worked there, I did not get tested for HIV. I had to basically, I think Laura had to force me. She was like, Kellee, it's been 2 years. Why have you not been tested? And I worked in HIV. So I just think that like there's a lot of fear even when you work in it, and you have to work kind of past it. Sorry, Jeff.
Y'all are giving some great suggestions, and a lot of it sounds very grand and all of that. But how much does it actually pertain to the work that you're doing? In other words, are you sitting there thinking to yourself, "Oh yeah, but I have this barrier to it because of my boss or my readership or my this or that"? You know, what's going through your minds as you're hearing this? Are you thinking it's doable, or that it's a little too?
I mean, the story that the mainstream media needs to be talking about is PrEP right now, and that conversation is only happening in the gay press and in the gay community, and that's going to be the next big HIV story to hit the mainstream media. So how do you pitch that story to the mainstream press, or get that on the radar of the health reporter at the newspapers?
Well, the first figures we had, they're probably outdated by now, but the first figures we had showed that most of the people on PrEP initially were women. Oh, really? So this is not a gay story. Yeah, women who were looking to be in charge of their own protection, not gay men. Now, that's probably starting to change as more gay men are coming to it, but do you want to?
Yeah, the New York Mag cover story that Tim Murphy wrote was really good.
And New York Times has done, some pieces on it too. And I think a lot of, just about the women on PrEP, a lot of that might be just because a lot of the guys, men on PrEP are in demonstration projects and clinical trials that are going on. So that's why maybe there isn't as much uptake. But I think the conversations are starting to happen. In fact, I think PrEP, probably PrEP and TASP and treatment as prevention and PEP and decriminalization or criminalization are the stories that are really happening in the mainstream media right now. That's where it's there's a story. I think.
Were you saying criminalization or decriminalization?
Well, both.
Criminalization, and if I can plug that.
And then the people who are doing the work against it.
If I can plug that issue, it's something I feel very passionate about. HIV criminalization is when someone is either prosecuted for non-disclosure to their partner, having sex without telling the person they're HIV positive, for which people are being demonized without the particulars really being known, or people getting a higher sentence, a higher level of prosecution for another crime simply because they were HIV positive. And by the way, if you don't think people are still going to jail for spitting on cops, they are. Still. So there's been a lot of advocacy around this issue, especially in the last couple of years. It's really kind of started to bubble up. But it's a story that even I've noticed in LGBT media, we get very sloppy about how we report about it, because we have a tendency of equating an HIV positive person having sex with criminal activity, simply because they had sex. They're clearly a criminal. Or they say intentionally infecting their partner or intentionally exposing someone. Most criminalizations, people who are being prosecuted, were prosecuted in situations in which no one was infected, in which they may have used a condom, or other sort of protective device, seropositioning, didn't get fucked, whatever the situation was. And so, but that doesn't matter. And you'll see in these stories, it'll always say intentional. It really makes this person out to be a monster. And intentionally exposing, well, what is exposure exactly when you are on successful medications and you are incapable of transmitting the virus because you haven't had a viral load in several years? Are you really exposing somebody? Was it really intentional? Those sorts of wording, I think that especially LGBT media, but all media really need to be pushing back on. Sorry, go ahead.